This arm is pretty easy because you can actually just look where everybody else went, which is fine. So you kind of feel, you kind of, push, see where you got, your best, stoutest piece of vein. You're going to want to go in at a lower angle. I think the book says like a 45-degree angle.
Wow.
I've seen some.
That hurts.
Yeah. I've seen some nurses do like almost like a 90-degree angle and then they'll drop it in. What I found for students and when I learned is the lower you go in, the better. So you want to go in right about like that. With this finger, and this is one of those things that everybody's going to do this a little differently, how you use your fingers. And as long as it works, it works. But you want to pin down this vein because these veins will roll. So you want to pin down the vein with your other finger, so that way when you access it, that vein's not going to be like, like dodge the needle. So you pin it down. You get down here like this, and then you go straight in, and see how it's filling up with Kool-Aid. That's what's supposed to happen. And it'll actually usually fill up a little faster just because you got more blood pressure than what's in that little bag. And when you make that first puncture, you want to go in like with a very purposeful, you don't want to like push it in real slow. You want to go in with sort of a purposeful, straight movement. Otherwise it will hurt, and the faster you go in, the less likely you are to tear up the vein or miss or have it slide off the outside of the vein. So once you get your flash, the needle is just your placeholder. You don't want to push the needle in or out. You just kind of want to hold it. And then there's a little tang on the top of the catheter here. You just put your index finger on there. And with this kind of plastic, it's a little more rigid than what skin would feel like, but you just push that catheter in. You'll see that little track of blood go up the catheter. If you see that, that's another real reassuring sign that you're in a good vein. So without pushing the needle, you push that catheter in, and then from here, what you want to do is put a little 2x2 under there, pop your tourniquet, and then you tamponade the vein, because blood's going to come out of this when you pull the needle out. So you have your piece here ready. And what's going to happen, it's going to bleed a little bit, and that's fine. If a few little drops come out, then you hook up your pigtail. You tighten it, make sure it's tight. Sometimes if you don't tighten it enough, it will come loose, like an hour or two later, and you'll have, saline or whatever leaking all over their arm. The IV will actually be fine, but it'll look like there's something, sometimes people accidentally pull the IV just because they don't know that it's just the hub isn't tight. So from here, what you want to do is you pull back a little bit, just enough to see you got blood return. You don't actually have to get blood into the syringe. And then you can flush it. And what you're looking for is, you just want to make sure nothing puffs up right here. If the vein, ruptured or something, you'll get like a big lump will just, like you'll know it when you see it. Sometimes patients will feel pain, sometimes they won't, but you'll see something pop up there. So you flush it, everything looks good. You can leave this on or you could take it off, it really doesn't matter. You take your 2x2 out. At this point, you want to kind of secure this a little bit with your finger if you need to. You don't want this popping out, but if it moves a little bit to the side, it's flexible plastic. It's not a big deal. And actually, a lot